I just had to add this on in the beginning. In the video, I might have said the second hospital wrong. It should be Norton Community Hospital. I don't think I said that. I'm not sure. I'm talking about Lonesome Pine Hospital in Big Stone Gap in this video, and Norton Community Hospital in Norton, Virginia in this video. Thank you. Hi. I am just going to show this cover during this whole video because I'm too sick right now to be on camera. I'm just able to talk some after several days because I basically lost my voice completely. I have never contemplated about making a video about hospitals before, but I have definitely got to share my experience with 2 hospitals and really let people be more aware about patient care. A little bit about myself. Currently, I'm 49 years old. I was a nurse for 15 years before I became disabled. I have above average intelligence, and I know my body extremely well because I have suffered from respiratory issues all my life and other major medical problems. So I just wanted to give you a background information. We dearly need medical reform in general because no one should be without insurance. It's a human right to have medical care. No one should have to suffer and die because they don't have insurance. People say, oh, that's socialist. No, that's a human freaking right. Everyone should have freaking health insurance, and the dirty dogs that think otherwise should lose their insurance and see what other people go through. I have been suffering for 10 days now with severe respiratory issues. I have a major sinus infection and major respiratory infection. I have gone to the ER 3 times. I finally was admitted the 3rd time overnight. Let me start with the first hospital, Lonesome Pine Hospital in Big Stone Gap, Virginia. I'm going in there in respiratory distress. I cannot breathe. I cannot take a deep breath in. I have not been able to sleep for a few days at that point. I think I had 1 hour of sleep in 3 days. I tell them all of my symptoms. I tell them that I'm a cardiac patient. I have severe heart failure. I have a defibrillator. I have Marfan syndrome. I have cardiomyopathy. I have COPD. I have asthma. I have severe allergies and a whole list of other medical conditions. I should be seen immediately, and I was taken back then. But when a person is in respiratory distress, and you can see they're in respiratory distress, they tell you about their previous history. You don't wait around. You immediately give them a steroid injection just to start the process. I mean, that should be a given. That should be a freaking given before you have tests or anything. And that used to happen at urgent care. So I thank God for urgent care back in Fredericksburg, Virginia. They had sense enough to know to get the ball rolling. Lonesome Pine Hospital, my first doctor I saw, he did start tests immediately. He did not give me the steroid injection immediately, what he should have done. But he did start test immediately. You know, they try to say, oh, certain levels are okay and not. Thank God I'm a nurse and that I saw that certain things were high. When I'm dehydrated, my lactic acid level goes up really high. When you have high lactic acid, you can die from that. You can go into respiratory distress. They eventually gave me fluids after I let them know I knew what was going on to bring the lactic acid down. It never did go out of the high range. And they sent me home. They should have never sent me home. When a person's in respiratory distress with my history, you do not send a freaking patient home. You know, they gave me some IV fluids. They called in an antibiotic, which I couldn't get because the pharmacy wasn't open. They called in a steroid. They gave me the stuff I normally would take when I have a flare-up. I give them that, but they should have never sent me home while I was in distress. I go home, I'm suffering all day and night, no sleep whatsoever. Couldn't go back to the pharmacy to get the refill because I'm in distress. I cannot get a deep breath in. I go back to the ER in distress, and they take me back. Doctor doesn't see me. I wait a long time. Doesn't try to give me any type of help until I can see the doctor. Cardiac and respiratory patients come first, unless somebody's, coding, of course. Doesn't see me. Oh, the doctor finally comes. Oh, you were in here yesterday. Labs were fine. No, the labs were not fine. They didn't even tell me that they saw that I had a severe sinus infection. I didn't find that out until the third trip to a different hospital that I will tell you about later. The CT scan didn't show pneumonia, which I knew it wasn't pneumonia. So if you don't have pneumonia, then you're a second-rate citizen to them. You could still have severe congestion, but if you don't have pneumonia, then they automatically don't give a shit. So I knew what I had. I have a history of bronchitis. But I don't get it lightly. I get severe bronchitis because I have all this other crap on top of it. And I just don't get a little sinus infection. I get severe sinus infection. I had deviated septum repair. It didn't help. But anyway, this one was ultra severe that I find out later. Blows me off. Didn't even want to give me fluids to bring the lactic acid level down. And let me restate, lactic acid you can die from. Didn't want to give me anything. Just blew me off. This woman was absolutely foul. Nurses didn't check on me ever. And the one that finally discharged me was just rushing and didn't care. Oh, find your own way out. And just hurry up and sign these papers. They just didn't do anything. Sent me home again. It's just mind-blowing. They blow you off. They don't take into account that you know your own medical history. You know your body. You know what you need to feel better, especially being a nurse. That has been a wonderful thing, me being a nurse, because I probably would be dead now if I couldn't advocate for myself. They just disregard you. If it's not like a full-blown pneumonia, but you're suffering and they see your labs are off, they just can't discount you and send you home. I'm really lucky to be alive right now. I pray I can get better because I can't keep suffering like this. But being days with only a couple of hours of sleep and I have severe heart failure, I could have gone into full-blown heart failure and died by now. And I felt like I was going to die. Going on to yesterday, this is now 9 days into suffering, not breathing. Oh, and let me tell you, my O2 sats, before I get to the third, both days my O2 sats were dipping down into the 80s. My heart rate was in the hundreds. Blood pressure was high. And respiratory rate was dropping super low. It dropped down to 4, and then it shot up into the 50s, respiratory rate. O2 sats dipping down drastically into the 80s. They did not care that my O2 sats were in the 80s. Didn't give me oxygen. Did not keep me on oxygen therapy. They only went by the few minutes that the doctor was in the room and saw that the O2 sats had gone back up into the 90s. But they disregarded my oxygen level saturation staying in the 80s for 95% of the freaking time for both of the ER visits to Lonesome Pine Hospital. I should have been admitted and I should have been on oxygen therapy. Okay, now going into the 9th day, still suffering, can't breathe, can't sleep. I decide, okay, I'll go to Norton Hospital. Maybe I can get a competent doctor. I go in there, again, respiratory distress. No doctor sees me immediately to do immediately, some type of palliative care when you're in respiratory distress. Get back there, finally I'm seen. The doctors are sitting around talking, not doing any type of patient care, and I have to wait to be seen. I see them because I'm directly in front of them, and they're all sitting around. This is at Norton Community Hospital now in Norton, Virginia, talking when they should have had their asses back talking to me. The guy says, oh, you've been to this other hospital. He did take tests, of course. He did do scans, blood work. Thank God Ballad Health sends your test levels to you immediately so I can see what's going on. So I could see that, my lactic acid was high again. And my other results that were not normal, I'm trying to think what they were. My potassium was low, my lactic acid was high, and there was another one that was off. And he wasn't going to do anything about it. He was just going to send me home, even though my O2 sats were low again. If a patient has low freaking O2 sats, you don't ignore them. I called my mom while I was waiting, and thank God, my mom is a wonderful woman, and she knows my history. So she calls them, and she talks to the nurse, and she tells her, not only has it been distressing for me, it's been distressing for her as well, worrying about me. And she wanted, them to know my history of breathing problems and that I don't throw off stuff. When I get sick, I get sick. And I think this caused the doctor to do one more test. They did a blood gas on me. Oh, and let me tell you that. My blood gases were bad at the other 2 hospitals. Still didn't keep me. So they do the blood gas, and he sees that my O2 level is low. So he tells me they're going to keep me. So thank God at least they're going to keep me. But he should have kept me anyway and did the blood gas before my mom called. But anyway, at least that was good. No beds. They said, well, can we transfer you to Lonesome Pine, or you're going to have to stay in the ER? And with my experience at Lonesome Pine, and I was like, no, I'll just stay in the ER. So I stay in the ER. They start treating me. Now, let me tell you the only good part about this. The respiratory guy, I wish I would have gotten his name. He was so freaking awesome. And he did advocate for me. He gave me this breathing thing to help kind of rattle the mucus out. And he also, you know, made sure that I got a dose of my acetylcysteine that helps loosen mucus, even though they weren't going to start me on it till the next day, because I told them I had been taking a couple doses a day and I've only had one dose and I need to get at least that to break up a little bit of the mucus. Excuse me. I know I'm going to lose my voice again, so I just want to make this video and get it out before I lose it again. So he was the only shining star. They did just the basic stuff that I would have done at home. There should have been some more tests. You know, they should have tried to look to see if there was any structure issues that were going on as to why, you know, I'm not breathing since it's been the 9 days so far. They should have ordered more type of, you know, pulmonary respiratory things, and they didn't. But they just did the general stuff overnight, really didn't do anything. I talked to 2 hospitalists, and this is another thing. Hospitalists a lot of times think they're God. They will go by textbook. They don't take into account variations from patients. And they make a lot of assumptions because they're in control. I have intracranial hypertension, and this is the doctors that are talking to me. They're trying to say all this other shit is a cause. Oh, you're on this is a cause, when I know it's not. I have intracranial hypertension. I took Diamox. Diamox is a diuretic. And it helps so the spinal fluid can, you know, drain, because that's what causes the intracranial hypertension, high spinal fluid level. And he said, oh, Diamox, oh, that's why your lactic acid is up. And I'm like, no, it's not. I haven't taken Diamox in months. Oh, in months you still can have it. You can't, you freaking stupid idiot. I took Diamox for a week, and I didn't even take it. I don't think I took it twice a day for a week. I only took it the week after I had my spinal fluid drained, so I could try to keep it down. But I was having side effects from it. I was having numbness and tingling in my head and hands, and it was severe. And I had a stroke, and it was causing stroke-like symptoms, and that freaked me out. So I stopped the Diamox after a week. There's no freaking way in hell that a week's worth of Diamox several months before was causing my lactic acid level to be high at that moment. And I had been off Diamox 2 years prior to that. He didn't give a shit about that. He still wanted to say Diamox, when that was not the cause. My lactic acid level was high because I was severely dehydrated from my diuretics and not drinking a lot of fluid because of my heart failure. So, idiot hospitalists, don't assume shit. Listen to your patients. If they're telling you something, they know their bodies and they know what they're taking. Excuse me. I can't even believe I'm able to make this video because mine still can't breathe. I still can't take a deep breath in because they've all ignored me. So hopefully I can see my regular doctor tomorrow and see what he can do, if anything, to try to help me or get me on something else that can finally help me to take a deep breath in and get some sleep and breathe. But anyway, let me go back to the story. I just got to tell you these things as they pop in my head. So there was the main hospitalist, and he was saying all this dumb shit about the Diamox and not listening to me about my history. And then there was another one. He was a little bit better. And I told him that that's not the issue. And so then I get to see one other hospitalist, and he said, when you leave, I will send you home with saline for your nebulizer that will help take the mucus out of your sinuses. And I will send you home with something for your ear. Because at that point, my throat felt like it was on fire, burning, and it felt like razor blades. And my ear felt like it was going to burst. The night before, it was hurting so bad, even if I would have been able to fall asleep, which I couldn't because I couldn't breathe. Excuse me. I might have to take breaks during this video because it's really hard for me to breathe. I wouldn't have been able to sleep because the ear pain was tremendous. I hadn't had ear pain like that since I was a child. So I was happy at least he was going to send me home with that. And I will have to get into a story about what I just said in regard to the final hospitalist I had to deal with. So I'm in my morning after being overnight, nearly them not doing anything. And I get this hospitalist and totally disregarding everything, every test that he saw that was bad, everything that I told him. He said, oh, well, we'll send you home. Just continue to take your stuff and you'll be fine. I told him I'm not going to be fine. My O2 sats are in the 80s. I can't take a deep breath in. I can't sleep. I've been having this pain in my neck. They disregarded that. Disregarded my chest being tight. Disregarded this weird feeling in my stomach. Everything disregarded. He said, there's nothing we can do here. I'm like, you can. You can give me respiratory therapy. You can do the different procedures that respiratory people do to help loosen the mucus. You can try to see if there's a structural issue. Didn't want to do anything. Never listened to me. Didn't want to stay in the room but a minute. He only wanted to stay in the room to say what he had to say and didn't want to listen to me. He did say he was going to try me on a different antibiotic. And this is when I found out how severe my sinus infection was, because he said you have a very bad sinus infection according to the CT scan. No one at the other hospital told me that. So 9 days, I have a severe sinus infection. I knew I had one, but I didn't know how severe it was. No one even told me. So he tried me on this antibiotic. I had an allergic reaction to it. Being a nurse, I know that I need them to give me IV Benadryl if it's a reaction, or they need to give you steroids if it's severe reaction, some epi if it's severe anaphylactic. So I knew I needed IV Benadryl. He's in the hall, and I said, nurse, I'm having a reaction. My breathing is getting worse, and my foot is itching bad suddenly. I need some IV Benadryl. She goes and tells the doctor, because I had told him I had a reaction. I was having a reaction because I told him first when he was in the room. He blew it off. He walked out of the freaking room. I hollered for the nurse. I told her, you got to get him to get me something for this reaction. And he said, oh, she told me, I know, but she'll be okay. It's a reaction to an antibiotic. It could be an anaphylactic reaction. He kept on walking down the fucking hall. She said, he's not listening. I said, you got to get him. Get me a different doctor. Get somebody. And finally, the bastard comes in the room and says he'll get the IV. How about I was going into an anaphylactic reaction? I really wish I could sue him. Oh my God. So finally, and then this particular nurse, she had had a bad attitude the whole time. She knew I couldn't talk because I couldn't talk at all. I had no voice whatsoever then. I'm just able to talk this little bit today. And she knew I couldn't talk. So she would have me repeat things as many times as she thought she could. Or she would just blatantly ignore me. And she had given me some insulin because my glucose was high from the steroids and I'm pre-diabetic. And it even took her a couple hours to give me the insulin because I had to call her back to tell her to give me the insulin because she ignored me and didn't want to give me anything. And she did that with every medication. And so I couldn't breathe after she gave me the insulin, and my blood pressure shot up and my heart rate shot up. That shouldn't happen with insulin. I've had insulin in the past when I was in the hospital. Insulin doesn't do that. So with her attitude and me having an allergic reaction and then all these other things happening after she gives me insulin, I'm not trusting her at this point. I'm thinking maybe she's one of these crazy fuckers in the hospital that's trying to kill patients because a couple of other patients were bad off. So I go to one of the nurses. I'm like, give me a new nurse. I'm not having this nurse for nothing anymore. She has a bad attitude. She's trying to make me talk several times, knowing I can't breathe or talk. She's ignoring me. And now I'm having reactions every time she gives me something. Okay, this is not going to happen. So I'm dealing with a terrible nurse. I'm dealing with a hospitalist that's going to let me have an allergic reaction to an antibiotic and not give me anything. And then this same bastard, I wish I could remember what his name was. I couldn't halfway understand what the nurse was calling him. I'm not trying to be a racist or anything. He was an Indian hospitalist the day that I went there yesterday. And he was horrible, just absolutely horrible person. Incompetent. He should be fired. I really should sue him. And I heard him talking and joking about all the medications I was on. He was saying it loud enough that I could hear him. I don't know if he was joking. I think he was joking with a doctor. Joking about the number of medications that I was on. And he made a joke about something else. I'm on a lot of medications because I have major medical problems. And he's laughing at me about my medical problems. What type of piece of shit doctor are you to do that? I really wish I had his name so I could call him out. I'm going to have to look it up, and I'll probably make another video, and I'll give you guys the name. But what type of piece of shit doctor do you have to be to laugh at a patient that's in respiratory distress and that's on a lot of medications? You know, it blows my mind. There are so many doctors that think they're gods, and they shouldn't be doctors. You know, God loved the good doctors, but that's just a piece of shit for you right there. A real piece of scum. And I'm really disgusted. Really disgusted. And that was the type of treatment I got. Didn't do anything extra for me. So let me go back and tell you, revisit what I said earlier about the other hospitalist. I saw one other hospitalist that morning before I saw this doctor. And he's the one that said that he would give me a nebulizer saline solution and something for my ear. So the doctor says they're going to discharge me. They're not going to do anything for me. And I tell them what the other hospitalist said about the nebulizer solution and the ear stuff. And he said, oh, no, he's not going to give it to me. And I'm like, why wouldn't you give anything to me that would help me? It's not a controlled substance, it's a saline solution to go into my nebulizer to help break the mucus up in my head. Why wouldn't you want to do that for me? He said, no. So they're in the process of just discharging me. The nurse that I said I didn't want to help me anymore comes back in with a nasty, bad attitude. I guess someone told her, because she was probably wondering why she couldn't give me meds anymore. And I told her that, the doctor needs to give me the stuff that the other doctor said he would give me. So she calls him, and he said, oh, no. Well, he finally did say, okay, I'll send it into the pharmacy, and lied and said that he sent it in. And he didn't send it in. He couldn't send me in a freaking saline solution from my nebulizer to help break up the mucus when he's the one that told me how bad the mucus was in my head. This is at Norton Community Hospital, Norton, Virginia. Absolutely horrible place. Absolutely freaking horrible place. The one nurse that brought me into the room when I first got to Norton, he was really nice. And then, like I said, the respiratory therapist guy, he was awesome. He did as much as he could for me. I wish I would have got his name so I could tell you who he was. He was wonderful. And I had one other nurse there that dealt with me for a while. And she was good. I mean, she couldn't do more for me than what the doctor told her to do. Excuse me. And she was good. But that hospitalist that morning that I had of discharge and that nurse that I had, they need to be fired. They need to be fired. And that hospitalist, that incompetent prick, for ignoring that I was having a reaction to the antibiotic, and for lying and saying that he was going to call in that inhaler stuff and didn't. That's just scum. And then joking about my meds and my condition. Piece of scum. And I hope Ballad Health, someone from Ballad Health, sees this video, because you really need to screen your providers better. They need to be retrained, and they need to have empathy for the patients and concern instead of treating the patients like crap. If you have a cardiac or respiratory patient, you go to them immediately, and you need to have a freaking protocol to give them some type of immediate treatment until you can get any type of labs back. That should be freaking common sense, especially for a respiratory patient. And you don't joke about a patient's meds or medical conditions with other doctors. You care about your freaking patient and their medical conditions. You don't look at labs that are bad and say, oh, your labs are fine, and send the patient home when you know they're bad. If a patient tells you, and they know their history, and they tell you why a certain lab is high, you treat them and you listen to them. I'm a freaking nurse, and I've had my conditions all my life. My lactic acid is high when I'm dehydrated. You give me some fluids and lower it. You just don't say, oh, it's from a medicine that you took for a week months ago. You don't discharge a patient that has heart failure and respiratory distress when you know their O2 sats have been in the 80s majority of the time, but you see that they were in the 90s for the 2 minutes you were in the room, and they were low 90s. You don't ignore a patient when they know their history better than you, when they know their body. You don't discharge a patient without doing whatever you can freaking do. You've got to have respiratory therapists in there. You've got to have pulmonary doctors in there that can give the patient some type of freaking treatment in the hospital. And at least do some further testing to see if it's something worse. I'm not trying to get too worked up because my O2 sats were low when I left the hospital. And I'm pretty sure they're not any better now. Especially because I can't still breathe, so I better not get too worked up. But anyway, here, I'm on day 10. And I still can't breathe good. I still can't take a deep breath in. I know my O2 sats are probably still low. And I still have this mucus in my head and mucus in my chest. White blood cell count was high still, and I'd already been on antibiotics. So you got a nasty infection going on. But I tell you, this Ballad health system is horrible. I wish that I hadn't become disabled. I wish that I could still work and be back in Northern Virginia to get some good care, because I've just had incompetent doctors here dealing with the Ballad health system here in Big Stone Gap, Virginia, Norton, Virginia, and had other incompetent doctors in Kingsport, Tennessee. This Ballad health system is absolutely horrible. One time I had to go to Holston Valley Medical Center, and they said that they could do a procedure. I waited in the ER for 14 hours, and only to be told they couldn't do the procedure after waiting 14 hours. I had a botched eye surgery that should have just been a routine surgery. Ended up having to have a second surgery, and now my vision is crap. I have double vision. So I have not had any type of success whatsoever with Ballad Health. I do have a good primary care doctor, praise God, and a good allergy doctor, praise God. But these ER doctors and nurses, not all of them, but a lot of them, have just been absolutely horrible, especially the ER. When someone is as sick as I am right now, with Marfan syndrome, heart failure, other cardiac issues, respiratory issues, and you can see I'm in severe respiratory distress with infection, and you're just going to blow me off. That's just so dirty, so dirty. And you see my labs, you see everything. So dirty. So I pray someone from Ballad Health will see this and reach out and really investigate these doctors, especially that hospitalist that I had at Norton, because I definitely should be in the hospital right now. So please, people, advocate for yourself. Don't let these doctors walk all over you. If you know your health history and you know your body, always speak up, because they don't give a crap about you. They want to get people in, get them out. And if you're not showing pneumonia, but you're still bad off, they will send you home and just leave you to die like they're doing me. I felt like I was going to die, and I still feel like something might happen. I really need treatment. So I pray to God that I can get squeezed in to see my regular doctor, and that he can figure out something for me, because my heart's not going to hold up much longer. Not sleeping now hardly for 10 days. And this much stress on my heart with my respiratory issues, my blood pressure shooting up, and my heart rate shooting up like this. So people out there that watch this, please pray for me that I finally get some relief and get a decent doctor that will do something for me. I'm sure there's so many other things that I could tell you about what happened, what dirty went on, but I really can't think right now because I haven't had sleep. And I know there was a lot more. I'm just so tired. I can't think of everything. But just a little bit of an overview about what happened. So hospitals, please retrain your doctors. Tell them to have empathy for patients. Tell them that all patients are not textbook. Let me say one thing about that too. I am not a wheezer. I can have a full-blown asthmatic episode, and I might wheeze for a little while at first, but I won't wheeze. I do not wheeze. I just can't breathe. I have diminished breath sounds too. I can't move the air around in my lungs. I don't wheeze. I just can't breathe. So, not every freaking patient is going to be by your textbooks doctors. If a patient tells you their history and they tell you that they don't do this, don't disregard the severity of their problem just because they're not textbook. Doctors really need to be retrained. So once again, people, advocate for yourself. Doctors don't know everything. Believe me. Being a nurse and from the experience I've had as a patient, doctors don't know everything. You've got to advocate for yourself. And I thank God that I am a nurse and that I know things, or I would have probably been dead before. And I might end up now for the no treatment that I'm getting. So please pray for me, guys, that I will finally get a doctor that's going to help me. And I better stop right now because I'm starting to feel really bad from all this talking. I really should not have talked this long. Thank you for watching my video. Take care.